Get your insulin levels measured. Glucose measures alone detect diabetes very late. Dr. Ben Bikman at the MetabolixOrg podcast. Brought to you by DoctorsToTrust.com.
Type 2 diabetes is a disease of insulin resistance. Not to say that there aren't other variables that are inputting here, but it is built on a foundation of insulin resistance. Let's look at insulin and then look at it through the lens of a cell itself. So here we have a cell, this big circle with an insulin receptor, so a door that only insulin can come and knock on. We have insulin receptors at every cell in the body, literally every cell, from bone cells to brain cells, from liver cells to lung cells. They all have insulin receptors. And because every cell has an insulin receptor, every cell responds to insulin, but the cells, of course, respond differently based on what the cell is and what its job is. So when insulin comes to an insulin receptor, that there is a cellular action. Now, to create an example of this, we have glucose. Some cells, like muscle, which I'll discuss in a moment, insulin will stimulate the uptake of glucose. So here we have glucose outside the cell, and now insulin allows the glucose to come in. Although, of course, insulin does much, much more throughout the body than just regulate glucose levels. But this is just an easy example. Now, this is when things are working right. However, based on certain insults to the cell, which I'll elaborate more on in a moment, we can have a cell that doesn't respond as well to insulin as it used to. So the action is compromised, or the cell has become insulin resistant. This could result in an increase in blood glucose, and it also is accompanied by an increase in insulin levels. But this is all what's happening when the cell has stopped responding as well to insulin. So what was once a polite knocking on the door of the insulin receptor now becomes a pounding as insulin is higher and more aggressive, if you will. And that is sufficient in some instances to restore the actions of insulin. But in the course of this definition, there are two things that I really want to emphasize. If insulin resistance is a coin, these are the two sides of that coin. One is the compromised insulin signaling itself. Some cells aren't responding as well as they used to the hormone insulin. And then second, the other side of the coin is that insulin levels are higher than they were before. We must understand or appreciate both of these sides of the coin that we call insulin resistance in order to understand how insulin resistance is so pivotal and fundamental to so many diseases. So with diabetes in mind, here we have an individual. Over the course of their life, they're becoming more and more diabetic. Or in other words, glucose levels are going up, because that is how we define diabetes clinically. It is based wholly on the glucose levels. Unfortunately, with this paradigm, what goes totally overlooked is insulin. And insulin is going to look something like this in the average diabetic. It starts low, and then it goes high. And then it's high for a while, and in some individuals, not all, in some individuals it starts to taper off. But there are two time points worth highlighting. This initial period of time is the period known as prediabetes or insulin resistance. Why this state is so often undiagnosed or overlooked is because glucose is normal in the state of insulin resistance and insulin is elevated. So insulin is the more sensitive or early marker, early indicator of progression on this pathway towards type 2 diabetes. And then as you see beyond that next hashed line, we now progress eventually into frank type 2 diabetes. This is a state defined by both elevated glucose and, yes, elevated insulin. Even though we say insulin becomes insufficient in some people, we say that, but insufficient is a relative term. It simply means there's not enough insulin to keep the glucose in check. That's true, but that is not to say that insulin has become itself low. It isn't. It is often still significantly higher, multiples higher than it was before in a normal, healthy, insulin-sensitive individual. This, nevertheless, is type 2 diabetes. But again, what I hope you take away from this is that our failure to measure insulin itself means we are failing to detect insulin resistance in its earliest stages.
Get your insulin levels measured. Glucose measures alone detect diabetes very late. Dr. Ben Bikman at the MetabolixOrg podcast. Type 2 diabetes is a disease of insulin resistance. Here we have a cell with an insulin receptor. We have insulin receptors at every cell in the body. Every cell responds to insulin differently. When insulin comes to the receptor, there is a cellular action. For example, glucose at the muscle cell. Insulin will stimulate the uptake of glucose. Insulin allows glucose to come into the cell. Dr. Bikman says insulin does much more than this throughout the body. Based on certain insults to the cell may not respond to insulin as well as before. When the cell is insulin resistant, there is an increase in glucose and an increase in insulin. Insulin is now pounding on the receptor. Sometimes this restores the cell insulin action. If insulin resistance is a coin, it has two sides. One side, compromised insulin signaling, so the cell's response is weak. The other side, insulin levels are higher than before. Dr. Bikman says, we must appreciate both sides to understand insulin's role in so many serious chronic diseases. Here is an individual becoming more and more diabetic over time. Glucose levels are going up. That is a clinical definition of diabetes. What is totally overlooked is insulin. Insulin starts low, goes high. In some people, it starts to taper off. In this initial time period, it's pre-diabetes or insulin resistance. It's often undiagnosed because glucose is normal. Insulin is elevated, but it is not measured. Dr. Bikman says, insulin is the early indicator of insulin resistance and pre-diabetes. The next time period, now the individual has progressed to type 2 diabetes. Both are elevated, glucose and insulin. Dr. Bikman says, not enough insulin to keep glucose in check, but it is often multiple times higher than normal. He says, our failure to measure insulin means we fail to detect insulin resistance, prediabetes, in its earlier stages. Annotated and summarized, easy to share with loved ones. To access these annotations, go to DoctorsToTrust.com or see the description below this video's title.